Welcome to CareTalk. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, what happened? You got run over by a car? You were a patient? What did you learn?
Well, John, the first thing I learned, unfortunately, is a crosswalk doesn't mean what I thought it meant. So that was a little bit tough. But then what I did learn was that they quickly get you to the hospital. I was in the CT scanner within 15 minutes. They took care of all the critical stuff right away. But then after that, for example, it was left to me to diagnose my own broken leg when I got up a couple of hours later to go to the restroom.
That can't be true.
Well, it's in my medical record, which you should have access to. But I had to do that, and I learned, yes, care coordination is not that great, still something we should be working on, patient engagement, and so on. That's what I learned, but I'm glad to be here with you.
Who should be working on those issues?
I mean, I think people are working on them. Everybody should work on it. I do think there is an opportunity for entrepreneurs there. Sometimes I hear from people that say, you know what, we're not making progress. The hospitals already say they have all this stuff, but I can tell you if they have it, they haven't put it in place yet. Enough about you. Let's talk about me, okay. John? So, there was an election earlier this month, and some places are interesting in the country. So in Maine, they approved the Medicaid expansion. How do we think about that?
Well, I think it's really cool that Obamacare and Medicaid, which were wedge issues for the Republicans, are now revival issues for the Democrats. And I think it comes down to the fact that healthcare is, most people in America look at healthcare as a right, not a privilege. And the more they know about Obamacare, the more popular it gets. And independent of the Twitter pulses from our tweeter-in-chief, we're actually, what you're seeing, I think, is a wave movement of support for Obamacare.
John, do you think that's just limited to Maine? I mean, are we going to just, the Maine is sort of like up near Canada and into the ocean. Is that going to mean anything as we go forward?
It's always dangerous to predict politics, but Maine's really an independent state. You know, the Republican governor, Democratic legislature, a lot of strongly independent leaners in Maine. I think it's a pretty good bellwether for the country. And no, I think it's I do think it's an indicator that, as is the accelerating enrollment in Obamacare, that the more people learn about what health care provided through Obama and in the Medicaid expansion represents, the more they like it.
So I do agree that, Maine may be a bellwether. They wrote the ballot question very clearly, so it said what you were voting on. Yeah, and but I think it's an explicit strategy. What they were voting on in terms of income levels and so on. The same thing I think has potential in Alaska, Utah, Idaho, other similar sorts of states in 2018.
Why do you pick those states, David?
Well, I think those are ones that actually they're already working on ballot initiatives there, and I think
all Republican states. Interesting.
Yeah, no, I think it could be. It could be something.
It is deeply ironic that a term of offense is now being as part of the offense for the Democrats. What are the implications for healthcare policy of all that?
Well, I'll turn the question back to you, John. So I think that it could be just, hey, 2017, it's a wake-up call. It's sort of an off year for the election. And you could say, there's no real implications. It happened. There have been a lot of tweet storms since then, all sorts of other things, tax plan, and so on. I mean, what's your thought?
I think that the more the Democrats can ground themselves in sort of economic and healthcare issues, the stronger they're going to show. And a Democratic success to take over the House would represent a return to, I think, bipartisan policymaking in healthcare, which would be a healthy thing. We would have coordinating, collaborative policymaking, which is frankly the only way we really make progress.
John, such an optimist. Well, it must be the end of the year kind of thing kicking in, or maybe they change your medication again. But I think that there's a real. It's nice to think that we're going to go back to kind of a bipartisan process, which I think you'd have to go pretty far back, maybe to the Richard Nixon era.
The guy who was hit in the head should not be talking about my meds.
Yeah, a guy to really have done it. So I don't know. I'm not so optimistic. I think one thing that happened was the Republicans decided right from the get-go that they were going to oppose the Affordable Care Act because they thought it was going to lead to single payer. And I think what's ironic is they might actually get there by having enough of a backlash, and we may have Medicaid for all.
There's just no way we're going to get single payer in the context of like a Canadian system. I think there's too much opposition to that. I think that's a silly thought. But I do think that we will you see an increasing hunger for fair coverage for all, which is frankly what most Americans already believe in. But it has to represent and reflect the varieties of healthcare in the United States. So I think that's sort of a crazy thought. I don't think that's going to happen. But you will have coverage for all, and I think that's coming, and it's inevitable, and it's going to be I think that the direct result of Obamacare. All right,
we'll see where it goes. So speaking of that, one of the things that Obamacare brought in was value-based care, things like accountable care organizations, value-based payments, bundled payments, and so on. Definitely taken a hit during the first months of the Trump administration. Where do you see that going next year?
Well, I think that value-based payment, which is kind of healthcare on a budget, is inevitable. It's being pushed by every health plan around the country. Frankly, innovative doctors and hospitals are hungry for it. It's coming regardless of what happens in Washington. What do you think?
I think that is a nice, optimistic and a little bit of a naive view. I think that the people that actually have to implement value-based care on the naive. Like
optimists own the future.
Yeah.
Pessimists may own the current.
I'll sell it to you. What's happened is that value-based care sounds great until it turns out, hey, that may hit my paycheck.
The only policy that's moved forward in the last few years that has consistent bipartisan support is all of the policies that have been legislated around value-based care. Your position is groundless.
Well, I think that when it comes to actually physicians practicing and CFOs in hospitals, they say, you know what? We were sort of pretended on value-based care for a while because we were sort of supposed to do that. It's kind of like in North Korea. You know, you have to look pretty when the leader comes by. And now that that's off, it's changed, and they're like, let's just go back to making money the old-fashioned way. Fee for service. You do a service, you get paid a fee.
You're driving your car looking in the rearview mirror. Value-based payment of all kinds of varieties is coming. It's here to stay. It's starting to insinuate itself into all of the Blues contracts, all of the contracts, and you're seeing, you know, innovative doctors and hospitals start to take direct risk. You're stuck in the past, Dave. Join the 21st century.
All right, John, I think I've had enough of those insults. Are you ready for the lightning round?
I sure am.
John, will the next HHS secretary be any more successful than Tom Price?
He'll fail. Anyone will fail where they have a boss that doesn't have a policy, isn't clear or consistent. That's not going to change. He can't succeed.
I'm worried he may succeed in ways that we don't like, which is that he knows how the bureaucracy works from having worked in the drug industry, and he may go and tear up regulations and be a real problem and succeed in a way we might consider a failure. I wouldn't like it, but I think he may actually succeed in his objective and maybe what Trump wants him to do.
Not going to happen. The bureaucracy will tie him down. We're safe. Roy Moore, Doug Jones.
Well, you gotta hand it to Judge Roy Moore for his public service role. Wait a minute. For staying in the race to allow people to define just how far will they go in the name of supporting party identity.
Judge Moore no more. Doug Jones is going to win because he represents middle American values and he's not a creep.
So, John, we're just finishing Black Friday, Cyber Monday, but no health care there. Next year, are we going to have any health care deals on Cyber Monday?
Absolutely not. This whole head fake towards consumerism about price and choice is fantasy land. Until healthcare really gets on a budget and there's real transparency, there will be no real consumerism in healthcare.
Well, I look forward to reviewing this tape a year from now just to show you how wrong you are.
I'm happy with that.
After Amazon makes its decision to locate its HQ2 in Boston, they will be putting the Cyber Monday sales on for healthcare next year, 2018.
Not going to happen.
I'm David Williams from Health Business Group. I've been speaking with John Driscoll, CEO of CareCentrix, here on CareTalk.
We're still arguing.
If you like what you see, why don't you subscribe right there by pressing this button, and we'll see you next month.
Thanks for watching.